Option C, radial nerve. Let's move to question number 102. During the concentric phase of the biceps curl, which muscle group is primarily responsible for elbow flexion? Option A, brachialis. Option B, brachioradialis. Option C, biceps brachii. Option D, triceps brachii. And the answer is option C, biceps brachii. Now let's move to question number 103. What is the primary function of serratus anterior muscle? Option A, scapular elevation. Option B, scapular depression. Option C, scapular protraction or abduction. Option D, scapular retraction or adduction. And the answer is option C, scapular protraction. Now let's move to question number 104. Which spinal level corresponds to the phrenic nerve? Option A, C3, C4. Option B, C5, C6. Option C, C7, C8. Option D, T2, T3. And the answer is option A, C3, C4. Now let's move to question number 105. Which muscle is responsible for initiating the first phase of swallowing? That's degglutination. Option A, staphylopharanger. Option B, genioglossus. Option C, mylohyoid. Option D, sternocleidomastoid. And the answer is option C, mylohyoid. Now let's move to question number 106. What is the primary function of the supraspinatus muscle? Option A, shoulder abduction. Option B, shoulder adduction. Option C, shoulder external rotation. Option D, shoulder internal rotation. And the answer is option A, shoulder abduction. Now let's move to question number 107. Which ligament connects the lateral malleolus of the fibula to the calcaneus bone? Option A, anterior talofibular ligament. Option B, posterior talofibular ligament. Option C, calcaneofibular ligament. Option D, deltoid ligament. And the answer is option C, calcaneofibular ligament. Now let's move to question number 108. During concentric phase of the leg press exercise, which muscle group is primarily responsible for knee extension? Option A, quadriceps femoris. Option B, hamstring. Option C, gastrocnemius. Option D, tibialis anterior. And the answer is option A, quadriceps femoris. Now let's move to question number 109. Which spinal level corresponds to the sciatic nerve? Option A, L4, L5. Option B, L5, S1. Option C, S1, S2. Option D, S2, S3. And the answer is option B, L5, S1. Now let's move to question number 110. Which muscle group is primarily responsible for lateral rotation of the hip joint? Option A, gluteus maximus. Option B, piriformis. Option C, quadratus femoris. Option D, psoas major. And the answer is option B, piriformis. Now let's move to question number 111. What is the primary function of the trapezius muscle? Option A, shoulder abduction. Option B, scapular elevation. Option C, scapular depression. Option D, scapular retraction. And the answer is option B, scapular elevation. Now let's move to question number 112. Which spinal level corresponds to the ulnar nerve? Option A, C5, C6. Option B, C7, T1. Option C, T1, T2. Option D, T2, T3. And the answer is option B, C7, T1. Now let's move to question number 113. A patient with diagnosis of Meniere's disease is undergoing physiotherapy. Which of the following intervention would be the most appropriate for improving balance and reducing vertigo episode? Option A, vestibular rehabilitation exercise. Option B, ultrasound therapy. Option C, transcutaneous electrical nerve stimulation. Option D, iontophoresis. And the answer is option A, vestibular rehabilitation exercises. Now let's move to question number 114. A patient with diagnosis of biceps tendinopathy is undergoing physiotherapy. Which of the following intervention would be the most appropriate in initial stages of treatment? Option A, eccentric bicep strengthening exercises. Option B, corticosteroid injections. Option C, cross friction massages. Option D, activity modification and relative rest. And the answer is option B, activity modification and relative rest. Now let's move to question number 115. A patient with recent total hip arthroplasty is undergoing physiotherapy. Which of the following exercises would be the most appropriate in the early post-operative phase? Option A, SLR or straight leg raise. Option B, closed chain leg press exercise. Option C, hip abduction exercises. Option D, bridging exercises. And answer is option C, hip abduction exercises. Now let's move to question number 116. A patient with diagnosis of multiple sclerosis is undergoing physiotherapy. Which of the following intervention would be the most appropriate for managing fatigue and improving endurance? Option A, high intensity interval training. Option B, aerobic exercise training. Option C, isokinetic resistance training. Option D, plyometric exercises. And answer is option B, aerobic exercise training. Now let's move to question number 117. A patient with diagnosis of complex regional pain syndrome is undergoing physiotherapy. Which of the following intervention would be the most appropriate for managing pain and improving function? Option A, mirror therapy. Option B, ultrasound therapy. Option C, transcutaneous electrical nerve stimulation. Option D, iontophoresis. And the answer is option A, mirror therapy. Now let's move to question number 118. A patient with diagnosis of thoracic outlet syndrome is undergoing physiotherapy. Which of the following exercises would be the most appropriate for improving posture and reducing nerve compression? Option A, shoulder shrug. Option B, pectoral stretches. Option C, resisted shoulder external rotation exercises. Option D, upper trapezius strengthening exercises. And the answer is option B, pectoral stretches. Now let's move to question number 119. A patient with recent anterior cruciate ligament reconstruction is undergoing physiotherapy. Which of the following exercises would be the most appropriate in late post-operative phase for improving neuromuscular control and functional stability? Option A, closed chain squats. Option B, agility drills. Option C, stationary cycling. Option D, isometric quadriceps contraction. And the answer is option B, agility drills. Now let's move to question number 120. A patient with diagnosis of Guillain-Barré syndrome is undergoing physiotherapy. Which of the following intervention would be the most appropriate in acute phase of condition? Option A, functional electrical stimulation. Option B, progressive resistance training.